Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
The topic today in Neighborhood Health Watch is influenza, commonly known as the flu. Symptoms can be mild to severe. It's a viral infection that attacks your respiratory system, your nose, throat, and lungs. And for most people, influenza resolves on its own. But sometimes the flu and associated complications can be deadly. Dr. Marsh Cuttino with Henrico Doctors Hospital is here to help us get informed. Thanks for joining us on First at 4.
Thank you.
What are your predictions about this flu season, and has it started already?
So we are starting to see this flu season starting, and it looks like it may be worse than usual. We're ahead of the spike for last year, and we have already had a number of flu positive cases in Virginia. Right now it's at the sporadic level, but several other states are seeing it go much wider and more frequently.
And talk about the symptoms, how the flu is spread, and the best way to prevent getting the flu.
So the symptoms of the flu are high fever, which comes on suddenly, cough, shaking, chills, myalgias, muscle aches, and some chest discomfort. It is spread primarily by coughing, and you either get it on your nose or mouth, or you touch something with your hands and then touch your face, and that transmits the flu virus. The best way to prevent transmission is to frequently wash your hands, cover your mouth if you're going to cough, and of course get your flu vaccine. And
we tend to think that we know everything about the flu. I mean, because it's been around forever. Every year there's the urge, the recommendation to get the vaccination. But can the vaccination actually cause flu-like symptoms?
So no, that is a myth. The vaccine does not cause the flu. It is an inactivated form of the virus that cannot replicate. If you are sick, you may get some muscle aches and some what we call myalgias. You may not feel as well as you normally would, but it is your immune system generating the antibodies so it can fight the flu and when you're infected with it later on. If you get the vaccine, you may still get a flu virus, but it is not as severe as it would have been if you did not get the vaccine.
So do you get the vaccination?
I get the vaccine every year, and I've gotten it for a number of years. In fact, research has shown that if you get the vaccine over multiple years, it exponentially increases your protection against the flu.
And quickly, what are some other types of medications or treatments that you could use?
So Tylenol and Motrin, of course, reduce the fever burden that you get. Tamiflu, if given within the first 48 hours, can reduce the length of the flu, but it doesn't cure the flu. It is not an antibiotic for the flu. So if you do get ill, you don't necessarily have to go to the emergency room if you're healthy. If you're over 65, under 5, have significant medical issues, you should probably go to the emergency room and get evaluated. But if you're otherwise healthy, you could stay at home, treat it with ibuprofen, acetaminophen, and lots of fluids.
But the message today is to get the vaccination.
Get your flu shot, please.
All right. Thank you, Dr. Cuttino, for joining us.